If you've ever felt a sharp burning pain that starts in your lower back and shoots all the way down your leg, sometimes reaching your foot, you already know what sciatica feels like. And if you're watching this right now, chances are you're either living with it or someone you love is. Here's the good news. Most people get better, but to get there, you need to understand what's actually happening inside your body. Let's break it down. Sciatica is not a diagnosis by itself, it's a symptom. It means that the sciatic nerve, which is the longest and widest nerve in your entire body, is being compressed or irritated somewhere along its path. This nerve starts in your lower spine, specifically from the nerve roots at levels L4, L5, S1, S2, and S3, and travels through your buttock, down the back of your thigh, past your knee, all the way to your foot. When something presses on that nerve, the pain follows its path. That's why sciatica doesn't just hurt in one spot, it travels. Some people feel it in the lower back, others mostly in the buttock, and some feel it all the way to their toes. So what's actually pressing on the nerve? There are several causes, but the most common one by far is a herniated disc. Between every vertebra in your spine, there's a disc. Think of it like a jelly donut. The outer layer is tough, but the inside is soft. When that outer layer cracks or wears down, the soft material can push outward and press directly on the sciatic nerve. The second most common cause is spinal stenosis, a narrowing of the spinal canal that puts pressure on the nerve roots. This tends to happen more as we age. Another cause you might not have heard of is piriformis syndrome. The piriformis is a small muscle deep in your buttock. In some people, the sciatic nerve runs right through or near it. When that muscle is tight or inflamed, it can compress the nerve, causing the same burning, shooting pain. Less commonly, spondylolisthesis, when one vertebra slips forward over another, can also cause sciatica. And in rare cases, a tumor or infection can be responsible, which is why persistent, severe pain always deserves a medical evaluation. Classic sciatica feels like pain, numbness, or tingling that travels from the lower back or buttock down one leg. It's almost always on one side only. Sitting tends to make it worse. Walking or lying down sometimes brings relief. Sneezing or coughing can trigger a sudden sharp flare. Now, here are the red flags. Situations where you should see a doctor immediately and not wait. First, if you lose control of your bladder or bowel, this is a medical emergency. Second, if you have severe weakness in your leg that appeared suddenly. Third, if the pain started after a fall or injury. And fourth, if you have numbness in the inner thigh or groin area, what doctors call saddle anesthesia. These signs suggest a condition called cauda equina syndrome, which requires urgent surgical treatment. The good news is that 80 to 90% of sciatica cases resolve with conservative treatment, meaning without surgery. The most important first step is staying active. Bed rest used to be the standard recommendation. We now know it makes things worse. Gentle movement, walking, and specific stretches help reduce inflammation and keep the nerve from getting more irritated. Physical therapy is the cornerstone of treatment. A therapist will guide you through exercises that decompress the nerve, strengthen your core, and improve your posture. For pain management, anti-inflammatory medications like ibuprofen can help in the short term. In some cases, a doctor may recommend an epidural steroid injection, which delivers anti-inflammatory medication directly around the nerve. Surgery is considered when conservative treatment fails after 6 to 12 weeks, or when red flag symptoms are present. The most common procedure is a microdiscectomy, a minimally invasive surgery to remove the portion of disc that's pressing on the nerve. Most patients feel relief almost immediately after. Sciatica can be incredibly disruptive, but it doesn't have to define your life. With the right understanding and the right treatment approach, most people make a full recovery. If you found this helpful, subscribe to The Joint Guide MD, where we break down bone, joint, and muscle health in plain language backed by real medicine. And if you're not sure whether what you're feeling is sciatica or something else, drop your question in the